And by the way, today, Casey reads bedtime stories to his kid, effectively using his own voice. And then you start looking at a patient population that is close to 3 billion. Why not think about what would the technology need to be for an able-bodied person like yourself, Sascha, or me, to say we would accept a brain-computer interface? This immense pressure where I think I'm just not keeping up.
Hey everyone, before we are starting with the episode, I need to ask you for a small favor. Every week we are doing a lot of research to get you the best insights. Please support us. Hit the follow button, share the podcast with your friends. Thank you very much. And now, let's start with the episode. Markus, great to have you today at Deep Tech Insights. So, your co-founder brings you the idea for a brain implant company. What did you think during that moment?
Yeah, so Sean, thanks a lot for inviting me. It's a real pleasure to be here and to discuss BCI with you. Given all of the podcasts you've done on AI, I think it's a natural progression. Really excited about the time we have together. Yeah, I thought he was nuts, frankly. Our relationship goes back even further than that. We met each other at boarding school, so we were 16. And it was the kind of boarding school where people asked each other what they wanted to do later in life. I didn't know what I wanted to do, but when I asked him like this, he responded and said he wanted to create the link between artificial and bionic limb. I was like, how does a 16-year-old have that kind of vision? But even more impressive was that he then built his entire career to achieve that. I think both of us at this boarding school were exposed to the patient population that became our focus later. We were both working with children that either had physical or other disabilities. I was teaching blind kids to climb an abseil. And so both of us, I think, had that deep appreciation for this patient population. And what Florian, on top of it, had as an engineer was frustration that technology was not being used to help them. And so then fast forward, both of us, I think, identify our calling. I straight out of university, co-found a company and many companies later, Florian contacts me in 2007 and says, where are you? I've got an idea. I'm going to come and visit you. And I was on vacation in Mallorca with my now wife. And he flies by and says, hey, I've got this really cool IP. I want to do this. Can you run the business side? And, we had way too much red wine because I pretty much said yes, only to then look at this later and figure out a couple of things. Firstly, medical device and implantable device technology was the worst performing sector in VC history in 2008. I mean, like the worst. Nothing else delivered less returns and was poorer in terms of even raising funds. And the idea Florian had was to deploy technology and get an implant going. Neither of us actually said brain-computer interface at the time. 2008, there were no implants for the brain. The first thing that had just happened was sort of deep brain stimulation for Parkinson's. And I remember the analogy we used was not BCI. It was actually to create a pacemaker for the brain. So it was really uncharted territory at that point. But I had bought into the vision pretty much as a 16-year-old. And so it was clear to me that having run a few ventures, this was going to be the next thing. And I just sat down to think through how best to do it, how to do deep tech and ensure that we could last potentially a long time, because it was clear to me that fundraising cycle, we would at some stage or other be dependent on fundraising cycles, but that those were unpredictable. And so my recommendation then to Florian, after researching this for a good 6 to 8 weeks, was to create a company, acquire an asset, and build a company that would very quickly have its own revenue stream and be profitable, so that we could generate our own cash and control the timeline a little bit ourselves, because it was clear to me it was going to take quite some time.
And did this work out?
It did. One always says you change your initial business plan a couple of times over, and we have in certain elements. But we went to a group of private investors. We suggested we'd be profitable in 3 years. We were actually profitable in 9 months. And the proposal that we had to them was that we would be the company that would provide tools to the neuroscience research community. So it took a page out of the book of Texas Instruments. I don't know whether you're aware of that example, but Texas Instruments created this calculator and distributed it across high schools. And the idea was high school students would learn to work with the Texas calculator. When they went into academia, then they would buy the high-end Texas machinery because they already knew Texas as a brand, as a workflow, and as a UX. And so we had a similar idea that we would be the ones providing tools to the neuroscience researcher, and as a result would have our finger on the pulse of what was happening in that space. And, it was already exciting in 2008 because the very first human had been implanted with a BCI, Matt Nagel, at MGH and Brown University as part of a company that was called Cyberkinetics, VC funded at the time. And he gave us that window on what was possible, that Apollo mission. He wrote an email using his mind only, and sent that email. And so that gave us a window into what was possible with this technology. And what we knew, however, was that a lot of things still needed to be, a lot of blocks, a lot of questions still needed to be answered. And so our idea was provide these tools for revenue to neuroscience researchers, and hear what they came up with. And that, in essence, over the years worked really, really well. We became the gold standard. The Utah rate, even to this day, our core technology invented in 1989, is the gold standard of BCI research. And so that allowed us to really tap into what was happening in that field, and I think meant that we were the first to see the potential of BCI. Yeah, and obviously with then Elon Musk coming in and making it a high profile area, the whole thing took off to another level. But yes, it worked. We generated revenue. We reinvested the profits, I don't know, $25 million or so along the way, and didn't need to raise funds or dilute, and could wait for the right time.
I think we need to do a few explanations before we are going deep into the topic. So what is a brain-computer interface, generally speaking?
Yeah, that's a great question. And obviously I'll have our slant on it because we're a company that provides, an ultimately invasive chip in the brain. And the Utah ray today is about 4 by 4 millimeters, and it sits on the brain, penetrates it slightly by 1 or 1.5 millimeters, and acts like a radio that picks up the signals from individual neurons in your or a patient's brain. And so from our perspective, a brain-computer interface is a device that will record that information from the brain and then allow you to interact with external devices, usually of a digital nature, but also allows for it to return the other way, so two-way, for you to send data also back to the brain, and through stimulation of the chip, achieve certain things. And so to make this more practical and understandable, a BCI and our BCI will allow for the recording of individual neurons in your brain. And so, we can understand what's happening in your brain. But also we're then able to send stimulation back to, for example, restore sensory function. And if you take a tetraplegic patient, for example, where that communication between brain and the rest of the body is cut or severed somewhere at the neck, then what this allows is to circumvent that break in communication, and allow somebody, as an example, like Nathan Copeland, who became tetraplegic after a car accident aged 18. But as part of these studies, he gets implanted with our brain-computer interface. We're able to record from his brain. This is done at Pittsburgh, the great crew, research and clinical team there around Rob Gaunt and Jen Collinger. And they record from his brain and then push that data to an external device, in this case, in some cases, a robotic hand, and he's able to control the robotic hand. So he restores motor function in many respects by being able to control this robot and to a very high degree. So he's able to move even just the little finger or the index finger. And there's a great video where Nathan meets Barack Obama, the then president, and they fist bump. So he controls the robotic hand to fist bump Barack Obama. He then shakes his hand, and there's sensors in the robotic hand that record information and send it back to Nathan's brain. And so Nathan is able to say whether the hand the robotic arm holds is warm or cold. So that's restoration of sensory feedback. So thanks to our device that goes both ways, read and write, we're able to achieve that. So that's, from our perspective, a brain-computer interface that achieves a very high level of function.
So you also mentioned the Utah array. You probably also need to explain that this is the connection between the brain and the external control.
That's correct. So effectively, this is the chip. Imagine a 4x4 millimeter chip. So it's pretty small. And it consists of about 100 little pins that then penetrate the brain and act like a radio to pick up individual neurons, which is a very high fidelity of data, very valuable data, for us to then be able to do all of these fantastic demonstrations of either motor control or sensory restoration or communication. It's another area that I'm sure we'll spend a bit of time talking about in this session. But that's all possible because that chip, that 4x4 millimeter chip, accesses that data, but is also able to stimulate back to the brain. Now, from there, you still then need to get the data out to a device that then computes it. And obviously, then you have to deploy algorithms to work on all of this data and make it meaningful. So, there's a whole system. It doesn't start or stop with just that electrode, with just that chip, but that is a critical component of the system.
So you're around for probably more than 20 years now. Like, how did your company develop, and how does the technology develop over time?
Yeah, I mean, we've been at this since 2008. The core technology existed since 1989. Dick Norman here at the University of Utah invented it, originally as a vision prosthesis, and then it was deployed for brain work. And in fact, the first person who built the very first Utah array still works at Blackrock and is an engineer, senior engineer in our team. But the technology had to be developed substantially to enable better research. So we spent the last 15 plus years to make sure that the technology was safe, that it could work for longer periods of time. So a key question was longevity of the device. And thanks to our work and the work of our microfabrication experts and team, we managed to make the technology very stable, very safe. So our longest standing implant is in fact Nathan, who's now coming on 11 years. So this technology has been implanted for 11 years and still functions. So that was a key issue. A second one was that the original system was very cumbersome, lots of cables connected to big machinery and supercomputers and things like that. And that wasn't very conducive to research either. And so we invested in miniaturizing every component of that system. And thankfully, it got done just in time when COVID hit. We had just delivered an at-home device, in fact, to Nathan. And so he was able to continue with his research at home, which was critical. And then innovation across the board on the system to just constantly improve in an incremental fashion that system, while maintaining its safety. And that's, I think, why it became the gold standard. But thanks to that many years of exposure and experience, I think we also then came to a realization about 2 years ago, sort of a real epiphany that really we needed something else. And the epiphany was that up to that point, we had tried to make the device work for tetraplegic patients or ALS patients, right? Patients who had lost function of some sort and who had a different risk-reward benefit calculation. And that's what the industry of research was kind of stuck in a little bit. And then 2 years ago was the epiphany for my co-founder, Florian, who realized, hang on a second, we might have been thinking about this the wrong way. Instead of thinking always about the MVP, the minimum viable product to push forward, why not think about what would the technology need to be for an able-bodied person like yourself, Sascha, or me to say we would accept a brain-computer interface? How would the technology have to change? What would we need to achieve and enable for us to say yes? If we hit that goal, then every patient population up to it would also have been serviced. And that epiphany led to a fundamental overhaul of our technology approach. And now gets us to a point where we have developed and built the next generation BCI platform, which we believe will leapfrog the competition, largely because it's just taken a very different design approach to some of these challenges.
You have the advantage that you have been in the field for a very long time, right? So you have probably a lot of data from patients, a lot of data how the brain interface is working. How do you use this data to implement it now into your new model, or how does this help you being around for a long time?
Yeah, in many, many ways. And I tell you, we stand on the shoulders of giants. All the researchers that have gone and done this fantastic research, the patients, we call them BCI pioneers. We're now at 56, so more than anybody else in the industry. And it's phenomenal to stand on these shoulders, because all of that work that has gone before has informed us in our design choices, in our product choices, and leads just to a much more extensive and deep understanding of the space. From, look, what do the users need? What are their needs? And how to factor that into a product design. But also specific to your question, how useful is that data and I would say in many ways, but let me focus on two. First of all, the data is extremely useful in allowing us to aim for what we call zero-shot calibration. So working from one patient to the next one is quite a challenge, because brains are different. And the example I can give you is of Ian, who went swimming out in South Carolina, hits a sandbank, breaks his neck, and is left tetraplegic. Ian then works at Ohio, who together with him run a BCI research study, and he's able to control, using his own hand, grab a glass of water and drink from it for the first time since his accident. Just phenomenal demonstration. And I find out that he's a car fanatic. I was like, would you one day like to drive a car using your thoughts alone? And he's like, absolutely, I would love that. So I call Florian. I'm like, hey, we live here in Utah. The Bonneville Salt Flats are just west of here, and it's where a lot of land speed records were created in days past. And I suggested to Florian, hey, how about we get a tetraplegic patient to set up a land speed record? And he's like, how much have you had to drink? So we end the phone call. I felt a bit dejected. I go back to dinner. And 20 minutes later, I get a call from Florian. He's like, I've thought about it. I think we can do it. So I asked Ian whether he'd want to be part of a study where we get him to control a car simulator. And he joins, really excited. And it takes about 9 months for him to control the car simulator at speeds of sort of 30 to 40 miles an hour, turning of corners, stopping, starting, kind of full control. 9 months. We then move to the second patient. And James, Caltech in California, is able to control it within minutes. And the reason why is we use algorithms, and we use that data to improve on the solution continuously, and are able to reduce that calibration from 9 months down to minutes. And where we ultimately want to be is zero shot, right? Like real time, no particular delay in calibrating. For that, data is absolutely critical. You need to have access to that data to run the right systems and algorithm to achieve that. So that's one factor. A second one is even just understanding beyond now motor control, sensory feedback, or sensory restoration or communication. What else can we do with this? And again, this is where data is absolutely critical. And you're right, we're the company with the most data. We've got the most patient. We have 55,000 patient days of data. Nobody else has that. And while, for example, somebody like Neuralink, which is a phenomenal competitor of ours, is really ramping up, obviously investing a lot of funds, and is also now in human patients, and I think they've just hit their 21st patient or so, they're still chasing that amount of data. And it's extremely valuable to us to identify what is possible with this kind of technology in terms of higher functions, even beyond motor, even beyond sensory restoration, and even beyond communication. But even for those three, let me just give you a sense of the achievement already over the last 3-4 years. So communication is a key ability of a brain-computer interface. And we have a patient, Casey, who's an ALS patient, very aggressive ALS, Lou Gehrig's disease. And within, a year and a half, he can hardly communicate. I mean, the only one who was able to understand him was his wife, to a very limited extent, frankly, and has a young kid. And then thanks to the BCI, the work with UC Irvine and California, there's fantastic work being done there. They even take recordings of his that they have. He's a climate activist, and there's some video recordings of him, and they use AI to recreate his voice. And he's now able to communicate using the BCI. He's doing so at close to 100 characters per minute. That's very close to able-bodied speech. And he has an accuracy in excess of 99%. Which is just phenomenal. And we've come from, I would say, maybe 3-4 years ago, 50-40 characters per minute, maybe an accuracy of 96%. If you think back to Steve Hawkins, he was able to communicate at 20-30 characters per minute. So a phenomenal development, all thanks to data, and then obviously the hard work happening in the background using algorithms to use that data and improve the solutions. And by the way, today, Casey reads bedtime stories to his kid, effectively using his own voice. And today he is close to locked in. He cannot communicate anymore verbally. He can use sort of a twitch in his muscle. But as his wife says, if he's given the choice of going out to explore the world or communicate with a BCI, 100 times out of 100, he will choose to communicate with the BCI.
Because you mentioned Neuralink also, like I think 2 times now, what makes them different? Is it like the same technology, or are they using a totally different technology compared to you?
Well, I think Neuralink joining and Elon Musk making this a focus of his was critical to the space, right? It increased awareness. It put BCI on the map, and much sooner than it otherwise, I think, would have. Their design choices are also now 5-6 years older, and were a reaction to where the space was back then. So back then, we would run our systems at hundreds of channels. I'd say maybe top out at 250 channels or so. Today we can run a system at 750, but they kind of went in and said, oh, it's got to be better than that. And so their system, I think today deals with 2000. Our learning and that sort of epiphany 2 years ago was, we've got to do much, much better than that. These are just incremental improvements. What we actually need to achieve is full scale of electrode count. And so in our design choices for the next generation BCI, we said, no, it's not a question of 700 or 2000. It's not even a question of 10,000. We need to be able to scale to many times 10,000 and set our goal for 100,000, which is not just one order of magnitude, but several orders of magnitude bigger. And so, Neuralink, I think, went that first step 5-6 years ago of saying, okay, the space has to do better. We've got to do better. And we've taken on that challenge and feel likewise that a BCI just has to do so much more. And the technology solution as a system has to convince an able-bodied person, because then and only then will we have addressed the needs of everybody else.
So when is this technology ready for the masses? Because at the moment it's still like a very small number of patients or testers who is able to get this implant. Like, when is this ready for the masses?
Yeah, that's a great question. And we always see it in sort of 2 phases or horizons. The first is as a medical device solution to address specific medical needs, whether it's the restoration of function, the restoration of independence. These are, as they've always been, a key part of our vision and mission, and they remain so today. In terms of being a successful technology or product for clinical translation, we think the time horizon is, 5 to 10 years. Obviously, we need to consider beyond technological improvement, which we've, embarked on, and many things have now been achieved and are executed. Extensive testing. These devices need to be, above all, extremely safe. And so all of that is in the works. And you have to run through all the phases, from animal testing to then in-human testing, to full-fledged regulatory approval. So one thing to consider in that timeline is that for medical devices, a regulatory clearance, whether in the US, in Europe, or elsewhere, is a requirement, and that does hold up the process to some degree. That's not something that just happens overnight, but it's something that we focus a lot of our attention and effort on, and I'm sure all other BCI companies do as well. But I would say something, given that we have shown this technology works for patients, that, for example, it restored the ability to communicate to Casey, the fact that it can increase independence of tetraplegic patients. I think the proof is there. It has been shown. And so now it's a case of ensuring that the technology we provide for regulatory clearance is safe, that it lasts for a long time, and that a very high level of biocompatibility is achieved. So in the Utah array, we've already shown 11 years, but it was our assessment that that was nowhere near long enough, and that we really wanted to aim for much better than that. And so our design choice for the next generation BCI platform was something that would last substantially longer even than 11 or 20 years. All of these things combined to then convince a regulator that they should clear this product for use with ALS patients, for upper limb prosthetic patients. And there, I think the time horizon, I'm not in full control of it, so I don't want to speak on behalf of the regulators, but I'd say something in the span of 5 years is absolutely possible. The second phase that then one can look at is broader adoption across humankind, and we're of the conviction that a BCI will benefit all of humankind one day. And there, a particular perspective or approach that is intriguing from our perspective is a BCI as a diagnostic tool, something that is chronically recording in a healthy person's brain and could provide you with all sorts of insights. Consider an early warning signal for neurodegenerative disease or so. And again, in some ways, right, the circle closes itself to that analogy that Florian and I had when we started Blackrock, becoming the pacemaker of the brain. And that's something we see of immense value to a broader public. I think for that to happen, the time horizon is a little bit more extensive, but as I indicated to you, in our design choices, we have been led by how does this technology work for and is accepted by the able-bodied population. So we're ready for it.
So the authority in that case would be the FDA, right?
For any regulatory clearance in the US, it would be the FDA. CE, that depends then, right? And BaFin, other entities that we already work with today. But there are others the world over. We work in Australia as well. And so, every country will have usually its own regulatory approval process.
So they are already part of the conversation, right? Like how do they see these technologies?
Yeah, absolutely. And been part of the conversation for, pretty much a decade already now. Obviously, more extensively since Neuralink pitched up and made much more of a public profile about it. I think they are still trying to get their head around what this will be and how it will impact. And sometimes those timelines, when I consider our timeline as a deep tech innovation business, I could easily be frustrated by how fast we move on things and how seemingly slow a regulatory body might move. But we have to respect the fact that they have a goal and an objective in life, and it's not to do things fast, but it's to do them safely. We embrace that and just work with these bodies and entities to the best of their ability. We help to educate them on what the device can do and how it functions. But in our redesign of the next generation platform, one key factor that played into it was how would a regulatory body see our choice of material, for example. There's been some interesting material science work. You've reported, on some things yourself, and that's no different for the medical device world. The amount of materials being considered is phenomenal, and there's materials out there that seem to be extremely attractive in how good they are at conducting electrical signals. And that's what this is about, right? The neural signal is an electrical signal. It gets recorded by a BCI, and even you stimulate back towards the brain. You could pick a very exciting new material. The problem is, if the FDA hasn't heard about it and has no history of how that material interacts with the brain, and so it's worried about biocompatibility, it will be extremely resistant and cautious. Whereas if you pitch up with the FDA with a material that it knows and is aware of, even if it's from another area, the cardio space or elsewhere, then you're already limiting or reducing the burden of clearance and acceptance. So as we went around our design choice, the opinion and position that the regulatory bodies have was a major factor.
Do you also see things speeding up with AI right now? Because regardless who I'm talking to, is it someone from robotics, from the energy field, from industrial robotics, it really doesn't matter. Everyone is saying it's crazy how their field is developing right now and how things are speeding up. Is it the same in your sector?
Yes, it is. And on two fronts. One, just the way we work as a company and the efficiency we gain from deploying AI. But secondly, in terms of how the technology works, how quickly we are able to change, adjust algorithms and allow us, for example, back to that question of calibration, of how to allow something that works for one patient then to work for other patients. That adaptation, let's say, is achieved through algorithms, and developing, building, and constantly changing those algorithms and optimizing them is where we deploy AI. I think there's another very sort of future perspective on that, which is how will AI enable and allow us to better understand higher functions in future. For example, the concept of intent. And also there, AI can be extremely useful. However, we also see the limitations. And so from our perspective, we spend quite some time in addressing a next level, another level brain AI, if you want, and building a foundation model around that, because it's our belief that there's also a certain limitation to the LLM models out there. And so developing something that is specific to the brain and allows us to tap into these next functions that we might want as humankind, needs us to kind of take that next step. But make no mistake, the advent of AI and has had an enormous impact on our industry as a whole.
That's interesting.
In many ways, the BCI is your natural kind of progression of AI, isn't it? It's your brain-computer interface. It's what connects your brain to that artificial intelligence. And so, we know we are pretty much at the nexus of the two.
And you said earlier that it is going like two ways, the interface. It remembers me kind of the scene from The Matrix, where he just like gets a connection and gets a program uploaded, and now he can do Taekwondo. Like, is something pure science fiction, or is it possible at some point in the future?
Yeah, I mean, look, I'd love to learn a language in 5 minutes, right? I mean, if I could, I could download it. I speak German, I speak Swabian dialect. I'd love to converse with you over beer in a Franconian dialect. Right now, it would take me quite a few beers and wine to achieve that, I'm sure. But what if I could use the BCI to download that and be able to do it? I don't think it's not perceivable, and it's not a totally crazy idea. It will require a substantial amount of data, of ability to download data and upload data. So, I don't think it's something that's right around the corner. But conceptually, it's not impossible, given that we've shown we can stimulate the brain. It's not entirely impossible. Is that the way it's going to work? Who knows? Maybe the glasses, with us looking into the glasses, and that's how we see the data, might be an easier way, just in terms of UX, for it to be achieved. But from our perspective, we like to stay, steeped in science and proven science at this stage. And so from our perspective, the restoration of function, it's something that's been shown now in so many patients. That's what should be optimized and pushed forward. The ability to communicate has already taken such an increase in efficiency that needs to be pushed further. And then I think a world in which maybe the BCI is sort of your interface to everything digital, is not that far away, and it's not unrealistic.
So what other applications are you looking into right now for the BCI?
Yeah, quite a few, but that's kind of confidential information to the company. But as I said, we want to optimize what is there already. And then I think the field that we find really exciting is that of diagnostics and of sort of hyper-driven diagnostics, the ability to really identify things early on and provide warning signals, and or to identify even the synergy between a BCI and medication. Today's way of finding out whether a medication works relies entirely on you checking the symptoms. How great would it be if you had a BCI that could say, okay, this dose of X medication is in fact working, and it's working too well, you could do with less of a dose, or actually it's not working well enough, you would need more of a dose. So there's all sorts of efficiency for personalized medicine that we could think a brain-computer interface can be a critical part of.
So maybe again to the interface, explain to us, like, how does it look like to get one now? Like, how does the operation look like? Is it risky or?
Yeah, and look, I mean, today we talk about what I'll say is a legacy technology, right? This is what worked for the research space, and from our perspective, it needs to be overhauled in a fundamental fashion. But today, a tetraplegic patient or ALS patient would need to undergo a surgery, and it's several hours. Pretty much a craniotomy. So a part of the skull would be removed, and then the chip would be implanted. In our case, that's nowadays up to 3, 4, sometimes 6, even 8 of these chips, so that we get a higher electrode count and can do more functions. And the risk of it, I mean, any neurosurgeon will tell you that they do these surgeries very often, that they're extremely safe from their perspective. But from our perspective, as we ask this question, what do we need to hit to allow for able-bodied adoption? We're convinced that it needs to be less invasive than what it is today. So from our perspective, the goal is a surgical approach that is far less invasive, is much quicker, but at the same time, extremely safe. So to your question, that's kind of the goal that we are setting ourselves, really leveling up another dimension to ensure that we'd all feel safe about it. And beyond the surgical approach, which is one question, I think another question people will have is not just the safety of inserting it, but the safety of it running. And that's where today we have the Utah Array. It's taken 20 years of collecting data, of running tests to get to this level of safety. We'll want to run that amount of testing and more for the next generation platform. But we also want to make sure that it does really well in terms of privacy. I think a lot of people will have some concerns over, and you mentioned the Matrix earlier, will it read my mind? Well, no, it doesn't actually. But what are my abilities to ensure the privacy of this device? And so Blackrock, and I think as one of the few players, if not the only player in this space, from the outset when we designed the next generation approach, had at the core of our thinking that thought of privacy, of allowing the user the absolute control over their device. In terms of the data that is transferred and that being safe, in terms of the protocols and it all being protected, but even the ability to say when does it work and does it not work. These things from our perspective were absolutely critical for the individual user to decide and control, and so that's what we've done.
Let's talk a little bit about Blackrock Neurotech in general. Like, where are you right now? Where's the headquarters? How many people are there?
Yeah, we're in Salt Lake City, Utah, out towards the west of the US, and we've been here since our founding days of 2008. Most of our team is here. We're just over 100 people at this stage, very committed engineers and every enabling resource. We do have some individuals in the company distributed across the US and Europe. So the whole BCI wave very much started in the US, but now is a worldwide phenomenon. And we have customers worldwide in terms of neuroscience research customers worldwide. But in terms of BCI research, the US was sort of the starting point. Things have happened in Asia, but also in Europe, it's really taken off. So at TUM and with a group around Simon Jakob, a real pioneer in Europe, he's now had his second patient. I think he's on to his third soon. Had a stroke patient, Maria, with whom some fantastic work has been done. And now Michael, in fact, Bavarian. I'm wondering whether he's Franconian, but I think he's Bavarian. But Michi, phenomenal individual, joins their research study. And there's a great video of him in German, in fact, that I'm sure you can find, where he is able to do things again that just he had not been able to do since the accident. He was riding his Mofa to the DMV to take his test for his car license, and got hit by someone, leaving him tetraplegic. But the awe that he experiences when he is able to control things again using the BCI is just fantastic and is really profound. So yeah, Michi is now part of a growing momentum in Europe. So we have some of the team members in Europe to ensure that we service that market to the best of our abilities. Yeah.
I saw also that Tether, the stablecoin issuer, is one of your investors, right? How did that happen?
Yeah, it was a contact of our board and investor network, and they joined in the last round, drove the last round, and made us, I think, the second best funded BCI company in the world.
That's interesting. But I think, like, especially Tether is investing all across the board, right? They are doing in so many technologies, also early stage. Crazy where they are.
Yeah, they've been a great supporter and investor in our company, and what we've achieved in the last 2 years, just in terms of the engineering of the next generation platform. I think we have caught up with and passed a lot of the competition, and done so with, I don't know, 1/10 of the resources that someone like, for example, Neuralink invested. So I've been really happy about the progress over the last 2 years.
And as you said that there is also a lot of happening worldwide right now, also especially in Europe. You mentioned TUM. Is it kind of, how do I need to think about the space? Is it very competitive, or is it more like everyone tries a little bit to help each other out to achieve the goals for a better world?
That's a great question. I think it is becoming more competitive for sure. There's quite a few aspiring BCI companies. There's also companies that do sort of elements of the system. We're a full system provider, but there are companies that have, maybe designed an ideal or what they think is an ideal material to consider, or that have a particular wireless communication approach or so. So the space really has attracted a lot of innovation and exciting players. But the collaboration element, I think, is there for some. It's definitely been a key part of our DNA. So we clearly saw a perspective on what we wanted to build as a next generation platform, and that is so extensive. This full system, there is so much involved. The challenge is so vast that to do all of that just ourselves, we realized very quickly would be foolish in some respects. I appreciate that some people approach it that way, and that's their prerogative. But from our perspective, it needed experts at the highest level in each of these areas. So we actually work with key sub-suppliers for some of these challenges and problems, because we want to make sure we have the very best solutions in place. And so from our perspective, collaboration has been a big part. We've tried to do it ourselves, and I think a key learning for us is that collaborative approach yields better results. It allows you to move faster with less investment maybe. And so it's been key for us. But the space is becoming more competitive, and I'm pretty sure that the collegiate atmosphere that we have, I hope we retain among the co-competitors. But it's a competitive environment, and so I think that will also spur more innovation. We have some big problems ahead of us and challenges, and we want to make sure that this technology is deployed in a safe manner and that it answers the needs of an ALS patient, of a tetraplegic patient, and that they don't have to wait for another 10 years for it to have impact, right? These are broad goals under time pressure, as far as I'm concerned. I mean, an ALS patient may not have more than 4 or 5 years to solve that problem. So we are under real pressure to get this done, and that's where the competitive streak is a good thing as well.
You mentioned 65 patients you have right now, right? Was it
56.
Was this the number? 56. So is there one of them you think of the most from a maybe also emotional perspective?
Not necessarily one. I feel extremely grateful to know a lot of them and spend time with them personally. It's one of the most rewarding things, in fact, of running this company and of having created it. That interaction that we get with Ian, with James, with Nathan, with Casey, Michi. I mean, just spending time with him. His dad, by the way, a big shout out to the support crew. It is hard. It is tough. I mean, Michi, I think, travels 45 minutes to the research lab at TUM in Munich from Rosenheim. That's, I think, where he's from. Nathan drives 2 hours. These are extreme hurdles for somebody that is tetraplegic. Enormous commitment required from these guys and their support team, their fathers, their mothers, their family, their friends. Just phenomenal how willing they are to give up their time to achieve this. So the interaction with the BCI pioneers is always just eye-opening, and I'm extremely grateful to now have had many interactions. And yeah, one of my fondest, I think, memories or moments is when I get into a car with Ian. He's actually able to drive with an assistive technology setup. And so whenever we meet anywhere near to where he lives in Ohio, I let him drive. And I just think it's absolutely fantastic that to see that level of independence that he's able to achieve, and then to discuss with him what a BCI could do in future. For him, for other BCI pioneers, extremely eye-opening. I think the case that has gone to my core strongest recently is that of Casey. The fact that somebody who is entirely dependent, who is no longer part of a family, but has become really a burden, then thanks to the BCI is able to communicate, and his wife will tell you he is now a father again. He is able to perform the function of a father again because he can communicate with his children. And he has this a great analogy where he says he's a big believer that with AI, with many other things, that medicine will improve radically now over the next few years, and that somebody will find a solution for ALS, either to reduce its impact or to alleviate entirely. And his analogy was, if he didn't have the BCI, he sees it all like a life as a train. And if he didn't have a BCI, he would not even have attempted to jump on that train. But because he has the BCI, because he's able to communicate, he has decided to jump on the last carriage of that train. And so that level of sort of profound will to live, and a BCI enabling and empowering that, is just phenomenal to see. And I, as I said, I feel extremely grateful, but at the same time, I feel a lot of pressure to get out there and make sure that these devices are cleared so that Casey can have them and doesn't have to sit at home, but in fact may even be able to explore the world outside with a BCI.
How big is the market actually? I mean, when the BCI is working and people can do more and more again on their own, communicate, maybe at some point move their fingers, maybe at some point move again or walk again. This is a lot of cost reduction on the insurance side of things, because right now they need to send people to help them, to wash them, to get them up, etc., etc. Like, how big is that market?
Yeah, it's actually a phenomenal size. And I think people are sometimes waylaid by thinking that, the patient population of tetraplegic patients, so individuals who are paralyzed from the neck down in a severe manner, is more limited. But what I think people don't realize is if you combine ALS, tetraplegia, other neurodegenerative diseases, you very quickly get to a sizable number. If you then include the ability of this kind of technology to really, in a major and fundamental way, restore function, then you start looking at a patient population that is close to 3 billion. So from that perspective alone, it's a sizable market in terms of patient population. And as you just indicated, it is also in terms of the value that this solution creates. I mean, we really believe that a BCI is a transformational platform for healthcare, for medical device, for clinical translation overall, financially as well. It isn't limited to the clinical translation. It will be financially just another level. And that's because of the efficacy that a technology like this can have.
Interesting. Marcus, is there anything we need to talk about we haven't talked about yet?
So many things. So many things, and I can't wait for the beer or the wine in Nuremberg at some stage or other, or whereabouts ever we might meet. I think we've covered some of the salient points, the BCI pioneers that are so close to our heart, but also the change in the technology platform that is required to make this beneficial to all of humankind. So I think we've covered many of the areas around the brain-computer interface.
Then let me ask one last question, because this is a question I ask every guest, and it's really interesting to see the answers from their specific topics. But what's your wildest prediction for the next 20 years?
Yeah, I was thinking you might ask for the next 10 years, but 20 years, I think far more able-bodied people will have an invasive brain-computer interface or implant than we think possible today. Both from a technological perspective and just how quickly things are converging and getting better day in, day out. I mean, I noticed your sort of nearly daily posts on chips becoming more powerful, by the week. That's a core technology, right? We talked about the neural interface, the array but what about the ASIC that sits behind that? This technology is going through the roof. AI is going through the roof. Just the convergence of all sorts of technological fields coming together, I think, will create a very different world. The surgical approaches to make this less invasive. So from the technology side, I think we will see a fundamental shift. But then also on the public perception side, I think we will see that people have, I think, with proven safety, privacy issues, these kind of things, I think reduced concern. It'll also be a generational element, right? When I talk to my children who are 16, 17, that's not the top concern on their mind. Yet when I talk to people in my own generation, it's like, oh, an invasive, you're approaching my brain, you're going to implant something in my brain, right? That tends to be the sort of biggest concern. So I think we'll see both of those things coalesce and result in a situation where far more able-bodied individuals will have accepted an implant. And I think at the same time, we will see a fundamental shift in medical device gain, in value created in medical solutions that will benefit all of humankind and reduce the cost of care and increase the number of solutions to medical problems that are, that today are either terminal or extremely grave on your ability to lead an independent life. So that's my prediction for sort of 20 years. Let me ask you briefly a question, Sascha, given that you offered and I didn't. What would make you accept an implantable BCI? What would it have to do for you to say, let's go?
I'm not sure about that. Because it's a tough question, right? It's a little bit depending on, do I need it to improve my life and how safe the operation by itself is. If you are saying, okay, right now we are talking about, I don't know, like 6 hours and some kind of a part of my skull has to be removed, then probably not. If I don't need it to move again. But if we are talking about like plugging something in very easy, maybe with needles directly into the brain, and then I can learn languages in a couple of minutes, or can learn, I don't know, like any kind of information I want to have, or communicate directly with the computer, or have my brain kind of switched into the World Wide Web and do like kind of research automatically, then maybe the decision is not so hard to do.
Yeah, just personally, over the last, I'd say 2-3 years, I have noticed on just my role as a CEO, this immense pressure where I think I'm just not keeping up. And it's obviously a function of AI and what is happening there and how fast it is happening. I get to points very frequently where I just think, am I able to keep up with all of this? And so where maybe 2.5 years ago or so, if you'd asked me whether I, as an able-bodied person, would would accept an implantable BCI, I'm not sure I would have been. Today, I just frequently find myself thinking, wow, to keep up, I'd really love to be able to connect with intelligence in a far better and more efficient way than I do today.
Yeah, it's also kind of getting crazy. There are people already talking about uploading their brain to the internet to make them kind of live forever. And I don't know, do you saw that experiment a few weeks ago where they actually uploaded the brain of a fruit fly, and the fruit fly actually behaved the same way in this digital environment as it would behave in the real world. That was kind of crazy.
Yeah, phenomenal. Absolutely phenomenal. Yeah.
Crazy times.
Absolutely. I have to admit that on that particular question, my preference would be to have an actual beer or an actual glass of wine with you, rather than it to be uploaded in the ether. So let's see whether we connect in Dortmund or some other place. And looking forward to meeting you in person and spending some time.
Would love to. Markus, thank you very much.
Sascha, thank you.